Hi, I'm Janie Dennis. I'm the coordinator for lab and simulation experiences at the college at Brockport, the State University of New York. I want to do a little tutorial with you on our human simulator. This is SimMan. We call him Frank. That's his generic name, although he can be lots of different things, lots of different people during your simulation. So when you start with SimMan, he will be on. As you can tell, he does breathe. And and blinks. So you can see that his chest does rise and fall. As you listen to his lungs, I can program his lungs to be clear, have crackles, have bronchi, be diminished. So you should be listening with your stethoscope with the aim of hearing accurate breath sounds depending on what the scenario is for him. Not only does he have breath sounds and blink, he also has pulses. He has radial pulses, which are a little higher than you might expect them to be for him. He also has brachial pulses, although not a brachial pulse on this arm because this is where his IV is. If we pull the covers down, you would be able to find pedal pulses. And those pulses can be bounding, they can be weak, they can be greater on one side than the other, and that's all programmed by your simulation instructor in a computer behind the two-way mirror. So the other things that you are going to be able to do with SimMan, he also has vowel sounds, He also has vowel sounds. He has anatomical parts that can be turned into male or female. He can be catheterized, which we will do, and NG tubes can be placed in the nose. But the basic things that you'll be doing with SimMan is communicating with him, checking vital signs, and assessing. In communicating with him, please notice that on his eyes and on his ears. On the ears are speakers, so your clinical instructor that is behind the two-way mirror, even if you're speaking softly, can hear you. So that's a good thing to be aware of, that your clinical instructor is going to be listening to how you're processing what you're going to do next. But there are also microphones. So SimMan can speak to you. It's actually your clinical instructor, but you will be hearing your clinical instructor talking to you through the speakers in his head. So that kind of helps him to be a little more interactive with you. Vital signs. Over on the cart, I'm going to grab, if I'm going to give vital signs on SimMan, I'm going to grab my blood pressure cuff and my thermometer. And put my blood pressure cuff on. There is an extra tube here. This tube does not need to be connected to anything. You can take SimMan's blood pressure manually. However, I have found that the noises really are really too mechanical, and it is more of a distraction. I know that you know how to take blood pressures because you had to test out on that. So you will be able to use the machine to take his blood pressure. So when I put his cuff on, I come over to the screen, and the screen is going to give me the information that I need to assess SimMan. This is pre-programmed based on what the scenario is, or your instructor can change those. You can see here on the screen it says NBP, so blood pressure, no cuff, touch when cuff attached. So I put the cuff on SimMan, and I just touch the screen. And when I touch this, down here it says start stop, and there's a little person there with the arm out. If I push start, you'll hear the blood pressure start to inflate. you can also see the cuff pressures increasing. So this is doing it, doing the automatic blood pressure, and that is okay to do during simulation. When you're in clinical, your clinical instructor may have you do manual blood pressures, but this is because there are some mechanical sounds there that are a little challenging. So we can see SimMan's blood pressure right now is 125/80. Now the other, some of the other information that you might want is temperature. So I did bring over our thermometer. This thermometer is for simulation. It is not truly working, but your instructor will expect you to use the thermometer as you would a real patient. And then you're going to come over to T-blood. If I touch this screen, you get a communication box that opens. T-blood off. Touch that, T-blood on, and you can see that his temperature is 99.0 and close out that box. Okay, so there's two of our vital signs. Another vital sign, SpO2, of course you know that that is for oxygenation saturation, and that is always hanging right here. And if you take this and put this on any finger of SimMan, you will see it give you a reading. His oxygen saturation level is at 97%. The beeping that you are hearing will happen, one, with the oxygen saturation monitor, and it will also happen with the EKG leads. To turn that off, you just touch the number. It's the QRS volume. And if you take that QRS volume and hit 0, it will stop, because that can be kind of irritating. Okay. I touched this and it gave me an EKG. Okay, this tells me what his heart rate is. However, we're in a training mode right now. During a simulation, in order for that to come on, you need to get your leads that go on the chest. Get a couple of the leads from here. I like to put the leads on these buttons before I put them on the patient, because it can hurt to push these on. So you would pull back the gown. You can use the little cheat sheet that I put here. White is on by the right arm. I'm not going to put all 5 on. Take this off. Stick it onto the chest. Stick all the rest of them onto the chest. All of the stickers on, and then you'll be able to touch that, and it will give you a heart rate, and it will give you the rhythm. I do understand that until you get to critical care, you may not have any idea what that rhythm means. However, you should understand that it looks regular, that it's at a regular pattern, and that is kind of what I expect at this level, is that you would recognize that at some point, if the patient's condition were to warrant you monitoring the heart closer, then you would put these leads on for him. The other thing that you can put on him is oxygen. I do want to show you his oxygen. Because he does not have his ears are almost non-existent. One way that you can put the oxygen on him, it's a little easier, is if you put this behind the head and put these in the nose. That's perfectly acceptable, and it will stay on a little easier. Plug it on, plug it in. This does not actually deliver anything, so you can verbalize oxygen on or oxygen at 2 liters so that your simulation instructor will know to make those changes on the computer. And when you do these interventions, you should reassess, and you will hopefully see an improvement in the patient's condition. If you do not do those things, you may see a decline in the patient's condition. So SimMan is very versatile. We can do a lot of things with him. The assessment is something that will help drive what you decide to do in the scenario. So reviewing what is on this computer and on this monitor, you have your heart rate and your rhythm, your SpO2, your blood pressure. When you put on the EKG, it will give you a respiratory rate and the temperature. And at this point, those are really the vital signs that you will need. So vital signs and then a complete assessment, and you will need to do a complete assessment for SimMan with each scenario. So I do expect you to be finding those pulses, listening to bowel sounds, listening to heart sounds, and listening to lung sounds. Speaking with SimMan, it is very challenging, and I do understand that it can be very hard to talk to a mannequin, but I need you to try to suspend your belief and get yourself into that scenario. It will help you, make you a better critical thinker, and have better clinical judgment when you do get into clinical. So I hope that you will find this helpful, and we will see you in simulation.